I was told when she was born that she will have obviously they told me, Mom, you have 6 months to be with your child because the condition she has, she will not be able to make it for long. But now she's here, 13 years later, she's here for this heart. And I'm so grateful, I'm really grateful that she's chosen to be one of the patients to have this operation, to give her a chance in life.
But 13 years later, Monica and her daughter Stephanie, who suffers from severe pulmonary stenosis, is still here, and she should be for many more. That's thanks to a team led by paediatric cardiac surgeon Dr. Kirsten Finucane from Auckland's Starship Children's Hospital, who travelled to Fiji's Colonial Memorial Hospital in Suva to perform life-saving surgery on children.
I don't think people in New Zealand realise just how severe the poverty is in some of the Pacific countries, and it's really, really important for us to extend heart care to the children brought up in disadvantaged places. How can we let children in a neighbouring country that's only 3 hours flight away die of a condition where with one surgery they'd survive? It just seems like that's just a ridiculous thing to do. For a small amount of money we can achieve a cure for that child.
The team of 30 medical professionals performed 14 life-saving surgeries, of which 11 needed a heart bypass, and the cost of the mission, just $80,000.
That's enough money to fly 2 children to the Starship and have surgery there, and we do 14 with that amount. Now, of course, that's because we get donated many of the pieces of disposable equipment that we use, and because all of the team come in their annual leave time, so we're not paying salaries. But that does cover everything else, and we get a lot of support and donations also from the Fiji community, as well as the New Zealand charitable causes that support us.
Dr. Finucane says she and her team have had to make some tough choices.
I think one of the most challenging parts is this. I'm going to say there's 2 things. The first thing is actually when we triage at the beginning, making the decision as to who you really can do and who you can't. That's very, very difficult because in New Zealand, you don't turn any children down. You actually do everybody. Some of them have more risk than others, but you do everybody. But here in Fiji, you haven't got that situation, and you have a limited amount of time. So you have to triage, and you have to decide who you can fit into the 5 days that you're operating, and who is most likely to get the most benefit from the surgery.
Cardiologist Dr. John Wright, who saw many of the children before the surgeries, says without the operations the children would have a much limited life expectancy and quality of life.
If medical teams weren't coming to Fiji to treat children, quite a large number of these babies would die within the first year of life. Those children that survive would have a limited life expectancy and quality of life. Varying in ages and sizes, the smallest we're operating on is only 2.2 kilograms and only a few weeks old, and others are in later childhood who have managed, although in a limited way, until now.
Nurses also made the trip up from Starship and other hospitals around the country. Jinga Lekinwala says it's been a dream of hers.
Just seeing the kids smile like you and forming great relationships with everyone. Yeah, I'm just thrilled to be here.
Will you come back?
Oh, in a heartbeat.
The trip is organised by charity Hearts for Kids. Grant Hanley is its mission coordinator. He's led the project for 4 years, but taken part in about 6 other missions.
I think it's a gift to be able to give back, and to see the little guys coming through, and they come in sick and they come out, and you can see the progress and their recovery. That's incredibly uplifting, and I think that's what keeps me coming back every year. I came once and I got hooked.
Jonathan Kerr is New Zealand's High Commissioner to Fiji.
This isn't just a government-to-government relationship between between New Zealand and Fiji. It's much, much deeper than that. Many Kiwis and many Fijians have very close ties with their counterparts in both countries. And the work that the surgical teams are doing in Fiji is a really big part of that. I mean, to have New Zealanders come to Fiji and save lives here is a really remarkable thing, and it speaks of the deep affection that New Zealanders have for Fiji, and it generates a deep affection for New Zealand among ordinary Fijians.
Ordinary Fijians like Stephanie and her mum Monica.
I'm really grateful for what they have done, and the team, the surgeons, the nurses, they are just wonderful. You know, they make you feel like you at home. They don't differentiate you, or you just have a patient care, but they also care for the one who's looking after the patient. They will come and ask, have you eaten something? Have you had enough rest? And it just makes you feel that you're part of a big family, you know? Like, I even feel like I'm part of this big family. The organization itself, the Hearts for Kids, is like my family now. And I don't think we'll be ever forget what they have done for the rest of our life. As long as Stephanie lives, her heart beats, Hearts for Kids will be our big family.
Because, thanks to Hearts for Kids, the rest of Stephanie's life will likely now extend much longer.